I was asked today how to know whether I'm at risk for having a lower milk production capacity. And that's a really good question because it's good to kind of be aware of that before you have your baby so that you're aware that that's a possibility and can maybe take some steps to be able to maximize your chance of success and how much milk you will produce. So some of the more common things that may put a woman at risk for having a lower production are being an older mom over the age of 35, having a history of needing some sort of fertility assistance, moms with underlying chronic medical conditions, diabetes and high blood pressure are a couple in particular, having preeclampsia or gestational diabetes during pregnancy, having a history of breast surgery, particularly reduction. That's not a definitive that you won't be able to breastfeed at all or produce any milk, but breast surgery reduction certainly does put you at risk. Having preterm labor, having a C-section delivery, anything that may separate you from your baby after delivery. So whether your baby has something going on and is going to the NICU, or whether you have preeclampsia and need to be on magnesium, or you're sedated for a long time, or you're sick, whatever it may be that leads to separation, that is a risk. So if you have one of these conditions and you are worried that you may be at risk for producing not as much milk as you hope to, what can you do? One thing is take a deep breath. Stress and worry in and of itself can lead to lower milk production. And reach out prenatally, and if you're already postpartum, then it's never too late to reach out to somebody who can help you, whether it's your OB or an international board-certified lactation consultant or a breastfeeding medicine specialist such as I am. We can help you with some tricks to increase your production. Sometimes it's as simple as adding in one more emptying session per 24 hours. There are some herbs and medications that can help. Sometimes it's being prepared for this possibility and planning to maybe start pumping right away to maximize your success. Not every woman needs to pump right from the beginning after delivery, but if you're at risk, it may be recommended. So reaching out to somebody who can help you with these tips and help you navigate that beforehand, as well as once the baby comes, to really be able to assess what is going on. Are you making enough milk actually? Or are you struggling? And do we need to potentially supplement while we do these other things to get your production up? I think many women worry about this, or women don't realize that it could happen and then are very, very surprised when it does. So that's why prenatal preparation is so important, whether it be one-on-one lactation consult prenatally, or a group class, or just talking to your OB or midwife or one of your caregivers to learn a little bit more about what to expect can be so helpful. And then as soon as problems arise, also reaching out to whoever it may be that you met with before, or somebody different if you needed, to help you get on track as quickly as possible. We can't always fix everything. Our bodies don't always cooperate, unfortunately, and that can be really, really sad and devastating to many women. But we are here to support you, to get you as far as you want to go, and to help you grieve if it does turn out that maybe things aren't going to look as you had hoped. So a lot of my job is helping women recognize when they have gotten to that point and addressing the emotions that come along with that. And many people who have gone into breastfeeding also struggled themselves. And so we've been there, maybe not through exactly what you're going through, but we've been through struggles, so we know how emotional that can be. So please reach out. You can work one-on-one with me. I have an ebook available, if not now, then soon, some classes and all sorts of options. So check out my website if you'd like to email me with questions. I can also help you to find somebody who is near you if you are having a production issue, worried about a production issue, or having other issues going on. Have a great day.